Hello, everybody. Well, it's a new year. Dr. Conrad, Life and Motion Chiropractic and Wellness, offices in Ridgeway and Kane, 205 Main Street in Ridgeway, 2 Grieve Street inside the new Thompson House in Kane. Check us out on Google, Life and Motion Chiropractic and Wellness. Anyways, there's my advertisement. So anyway, New Year's coming. Everybody's got resolutions. Want to get in shape, want to feel better, blah, blah, blah. The one thing that I see that stands in the way of most folks is their ability to just move, okay? So many people run out and buy equipment, subscribe to stuff, or buy memberships, and within a month to 6, they're done. Why? Because something hurts, more than likely. The agony of trying to get through whatever it is that's bothering you, and not enough advice. But aside from that, I'm not here to give musculoskeletal advice except to show you a few ways in which to move better. What I plan to do is a series of videos where we start from the head and work our way down. I'm going to keep it small, bite-sized, 15 minutes tops, attention spans and what have you. You don't need a lot of room to do what I'm about to show you. You just need to have some time, and not a lot of that. You can do this as often as you want. It's not going to hurt. Thing is, if any of these movements that I show you are painful, then maybe you might want to seek out some sort of advice as to why that movement is painful, and if there's something significant that needs to be dealt with before going any further. But all I'm going to do is show you some simple gravity-based, body weight-based types of movements that will get you moving better and feeling better, and then maybe you can find some longevity in the gym. Okay, so that being said, hope that makes sense. We're going to start with head, neck, shoulders. Sorry, text messages coming in. Okay, back to this. We're going to start head, neck, and shoulders, upper thoracic spine. Like I said, we're going to keep this into bite-sized chunks. So the biggest thing that you need is a wall, a blank wall. That's all you need to do this. I recommend doing this against the wall because it puts you in alignment, okay? I call it my posture ruler. So what you're going to do is you're just going to stand against the wall. Now, so there's going to be some people that have, okay, hyperkyphosis, forward head posture, forward rounded shoulders, and forward head posture. Getting up against the wall is going to be tough. Well, that's why we're here, okay? If you put in 5 minutes a day doing this, you're going to start getting closer and closer to the wall. All you got to do is just hold and breathe. Hold and breathe, hold and breathe, hold and breathe, okay? So what we're going to start with is we're going to get against the wall. My feet are probably half a foot width, half a foot length. My heels are a half a foot length away from the wall. I got my belt line, my butt resting against the wall. I'm going to bring my shoulders back. Now here's where it's probably going to start to become problematic for some because of the forward rounded shoulders, the increased kyphosis or the curvature of the mid-thoracic spine. So what I want you to do is just focus on drawing your shoulder blades back against the wall, and you're going to externally rotate. So you're going to take and you're going to externally rotate your arm, your extremity, so that your palm, your thumb is going out and towards the wall as you stand there. So you're going to bring your shoulders back, and you want to get your arms as flat against the wall as possible. So that's where this is going to take some work. Okay, this isn't probably going to happen overnight for some. Now, don't gauge your ability based on, I do this all day, every day. Okay, so we're just going to work, we're going to just start here against the wall. Bring the shoulders back. Pin your goal here, if you're having trouble just here, don't worry about the neck yet. Just work on externally rotating your shoulders, externally rotating the shoulders, bringing the the back of the forearm against the wall, okay? And you want to have the thumb, as you externally rotate, you want the thumb to touch the wall, and then your goal is to get your arm flat against the wall, okay? So all we're gonna do, half a foot, heels half a foot length away from the wall, standing against the wall, and remember, we're gonna breathe. And that's the one thing that's gonna also inhibit some folks, is their ability to diaphragmatically breathe. So many, I find, breathe from the chest, okay? Watch any small child, okay? Watch any small child breathe. They all breathe from the belly. Their bellies go in and out, in and out, in and out, in and out, okay? You've got to learn to diaphragmatically breathe, and we're going to get to that next. But we're going to go back to this. So externally rotate the shoulders, flat arms against the wall, thumbs against the wall, the back of the hand against the wall. That's our goal for this movement, okay? And then all we want to do, okay, is breathe. Breathe. If we can't get the head back yet, don't worry about it. If you've accomplished it this far, then congratulations and kudos to you. Now we're going to work on the neck. So now that you're breathing, okay, we're going to start to breathe, because breathing comes next, and that's going to make getting the neck back against the wall even easier, okay? So we're going to put a hand on the belly. We're going to put a hand on the chest, okay? What we're going to work on doing is getting this bottom hand, watch. Notice this hand doesn't move, and that's the goal here, okay? So as you're doing this, if you see how this hand's starting to rise? You want to work on keeping this hand motionless so that this part doesn't move and this hand goes in and out. So imagine somebody's got a string tied to your belly button across to the opposite wall, and as you breathe in, they're pulling that string and drawing your belly button towards the opposite wall, okay? Towards that opposite wall. We're going to stand here and we're going to breathe. And as you do this, even if you can't get your neck back against the head, the back of your head against the wall yet, I want you to just be head up and envision somebody's got a string tied to your head, okay? And they're drawing your head as high up as you can, almost like they're trying to lift your heels off the floor, okay? So you're gonna breathe. How are we doing so far? Now, we're breathing. Now for the neck. So from here, we're breathing, our arms are back, we're externally rotated at the shoulders, we're breathing from the diaphragm. Now, how do we get our neck back here? Okay? So all you're going to work on, if you're way out here and you can't touch your head against the wall, you're just going to stand here and breathe, and you're just going to slowly, from the shoulders, what you want to do is envision that you're closing the silverware drawer. Pushing the silverware drawer closed. And you're going to feel a stretch. And you're not going to hold this. You're not going to try and do a prolonged stretch initially. Okay? Some folks are going to just be able to get right back and draw that chin back. And what I tell folks is envision that you're trying to flatten your neck against the wall. You also, with your knees, you want to leave your knees just slightly unlocked. Just slightly unlocked. Okay? Now, if you're finding even all of this difficult because of lower back issues, okay, that's going to be the next video. Okay, we're going to work on that anterior pelvic tilt and why the low back can also create issues to where you can't even get the upper back against the wall. Okay, so let's refresh. We're at about the 9.5 minute mark. So bear with me here. We're going to go all the way back to the beginning and we're going to set this all up all over again. So we're going to find a wall. That's all you need is a wall to do this exercise. Or if you're having trouble standing because you're having low back pain, then find a chair with armrests, push that chair up against the wall, and sit in the chair up against the wall and do this in a chair against the wall. Okay? So, standing, knees slightly unlocked, heels a half a foot length away from the wall, We're gonna get our tailbone and our belt line against the wall. We're gonna bring our shoulders back, okay? We're gonna bring our shoulders back, and what I tell folks is when you're bringing the shoulders back, envision that you're taking this shoulder blade and tucking it into the opposite back pocket, and then this shoulder blade into the opposite back pocket. So when you bring your shoulder blades back and you flatten your upper back against the wall, it should look something like this, okay? And I'm going to show you a different view of this from the side so that you can get an idea of what it should look like. But when you get here, okay, you want the shoulder blades back and flat against the wall, externally rotate your shoulders, okay, bring those thumbs around, touching the wall, and then work on flattening those palms and the back of your forearms against the wall, okay? Now, we're going to flatten the neck against the wall. So we're gonna bring our head back, we're just gonna tuck the chin. Envision you're closing the silverware drawer. Or I tell folks, envision that you're just flattening your neck against the wall, okay? The goal of this exercise, okay, is to hold this position for a maximum of 2 minutes. If you can't get to 2 minutes right away, I don't expect you to, but the goal is to get into this position for 2 minutes and diaphragmatically breathe. So here is it all together in a nutshell. And try to breathe as deeply as you can. You're going to notice initially, if you've gotten good at diaphragmatic breathing, okay, that once you get into this full neutral position, the diaphragm might not expand as far as you're accustomed to. So that may be where you need to do some work, is getting into this position, working on your 2 minute time span, and focusing on trying to get as deep a breath as you can, because that's going to stretch those ribs. It's going to mobilize that mid-thoracic spine, okay? It's going to open those costovertebral joints, okay? Yes, the ribs articulate on the vertebrae. There's an actual joint called a costo, or it's Latin for rib, I believe is what costo, the prefix is, costo, vertebral joint, okay? So those ribs articulate on the vertebrae. They swing like bucket handles. Okay, so if you feel tension, it's probably because your ribs are locked up. So this breathing exercise, this position, this neutral position, is a really great exercise to open that whole thing up. All right, so let me show you what it looks like from the side. All right, so side view, lateral view. All right, so my feet, my heels are half a foot length away from the wall. Okay, I'm standing as tall as I can. I'm envisioning somebody's got a string tied to the top of my head, is trying to pull me aloft, okay? And again, I've got a string tied to my belly button, okay? Because we're gonna diaphragmatically breathe when we get into this position. So drawing that belly button out, the chest remains still, okay? So we're in our position, sacrum, belt line against the wall. We're standing as tall as we can, externally rotating those shoulders, okay? Bringing those shoulders back, tucking those shoulder blades into the opposite back pockets, flat back palm or flat back of hand against the wall, externally rotated shoulders. We're back, relaxing into our position, and I like to close my eyes and just pay attention to the function, how everything's working, and then kind of breathe. If I'm finding restriction, trying to breathe into those restrictions. Really tucking that chin, trying to keep that neck flat. I noticed my chin was jutting. You want to try and tuck that chin, okay? The overall, hold on, let me bring you back around to the front. The overall goal of this exercise is increased mobility, okay? So if you're not moving real good right now, and there is no other than, now mind you, there's probably going to be some discomfort in this if you haven't moved this way in a very long time. Stretching, discomfort is normal. So don't expect to feel comfortable doing this. So if you're having that kind of pain, then that's normal. Okay, but if you go to just if you're moving and it's like sharp and like, oh man, I can't even get the shoulder, in that position, or I can't even get my, neck or what have you, then probably you need to go get evaluated somewhere, and find out why that pain is occurring. But then again, if you're having some discomfort, try this a little bit. Maybe some of this mobilization is something, maybe you get a joint to release. But if it's going beyond 3 days, okay, and this pain's just not ceasing, and you're just trying to go real easy with all of these motions, just trying to slowly, gently get into these positions, and that's all I expect you to do with this, and it starts to exacerbate that one particular pain, then yeah, it's probably time to go get evaluated somewhere, okay? All this is going to be is body weight. This is all going to be using your body mass against gravity and trying to get into what we deem anatomical position, and just be able to hold anatomical position. If you can't currently hold anatomical position in an upright, standing against a wall without ease, then you probably shouldn't be lifting weights and all. You need to work that posture and work those muscles and get yourself into a position first to where you're moving optimally, okay? And if you're already doing some of this stuff and you're having some hang-ups, go back to biomechanical alignment and start using some of this stuff and lining yourself up. And maybe you get some things to stretch out and you start to see where you're getting hung up, okay? So work with this stuff. Leave me some questions in the comment section, okay? You can contact us on Facebook. Leave us a message on Facebook. Hey doc, I'm watching the video, and hey, I got a question regarding this. That's all this is, just some advice, some movement advice. People aren't moving correctly, and I find if people worked a little bit more every day on just moving their own mass against gravity more efficiently, they wouldn't need guys like me. Anyway, hope that helps. You guys have a great day.